Hello, I'm Dr. Nandini. Today I want to talk about the genetic syndrome screening in the first trimester. In the last video, I had told only the name of the tests which are done in the pregnancy. But now today I'll talk in detail about the NT scan and the double marker test, which is usually done around 11 to 13 weeks. So coming to the NT scan is nothing but nuchal translucency scan, where the nuchal translucency, that is a neck fold thickness or the neck, the skin, in the common word if you want to understand, it is a thickness of the neck tissue in the baby, which will be measured in the NT scan. And if the thickness of the neck fold is more, then there is a chance of baby having a genetic syndrome. And there is one more important thing which will be measured in the NT scan will be a nasal bone. If the nasal bone is smaller in size, or it is not developing, or it is absent, then there is a high chance that the baby might have some form of genetic syndromes. Usually, what are the genetic syndromes? Usually, it is trisomy 21, trisomy 18, and trisomy 13. So, the scanning is called as a NT scanning, which is performed by 11 to 13 weeks to assess the nuchal translucency and the nasal bone. It has to be always combined with the blood test, which is called as a dual marker or double marker, in which they will take the blood sample of the patient and they will send for the testing. In this they will take your scan findings also, which is NT and NB, that is nasal bone, along with the blood sample. They will give the final estimate of the risks which is associated with the baby acquiring any kind of a genetic syndromes. Usually the 3 trisomies will be estimated in this screening test. So it is always better to do the NT scan and the double marker test in the 11 to 13 weeks to avoid the baby having any genetic syndromes. Even if it is having any genetic syndromes, it will be detected very early in the pregnancy. Thank you.